Good evening, everyone. Welcome to the fourth episode of The Surgeon's Perspective, the series in which we sit down for a conversation with a surgeon and understands the intricacies of their fields of expertise. So today we're going to talk about problems of related to walking in children, and for that we have with us Dr. Sandeep Patwardhan, a renowned pediatric orthopedic surgeon from Sancheti Hospital, and he was the perfect choice for this because this is his area of expertise. And when we talk about walking in children, we all have gone through, maybe with our kids, with our relatives' kids. Whenever a kid starts walking, we all have that one fear in our mind: is he walking correct? Is his knees a little wobbly? Is his foot not falling correctly? Is he walking a little crooked? So all these questions, why does that happen, and what all actual problems that happen with kids and their walking? So these are the questions that we're going to ask Dr. Sandeep Patwardhan. So let's all welcome. Hello, sir. Thank you so much for joining
Hi.
this today.
Hello, good evening. It's a pleasure to be here, Saurabh, and looking forward to all your questions.
Yes, sir. And again, thank you so much. This is a topic which is close to everybody's hearts because everyone loves kids, and when they start, the first step that a kid takes is a moment of joy and celebration for the family. And when that walking starts, and when a person has some kind of fear in their mind, is my kid walking properly or not? And that is something which
Yes.
troubles, I guess, all the parents and grandparents. I have kids in my house, and I have seen how my relatives go bonkers over the fact that is he walking correct or not. So before getting into today's topic, I would like to ask you, see, pediatric orthopedic surgery, it's a niche variant of orthopedic surgery.
Yes.
How did you decide to pursue your masters or pursue your career in pediatric orthopedic surgery?
So, Saurabh, can you hear me?
Yes, I can loud and clear.
Um, okay. So, pediatric orthopedics essentially, if you look at it historically, orthopedics, the word itself means orthos and pedia, which means the crooked limbs of a child. So
Hmm.
historically, pediatric orthopedics was always started off as deformity correction in a
Right,
small child by
right,
binding them with wooden sticks or some such structures. Uh, till the world wars happened, and then everything moved to fracture management and fracture care, and then later on it all went to the lifestyle orthopedics that we see today: hip replacement, knee replacements, and such areas which are more attractive. But the core orthopedics always remained pediatric orthopedics, which was a fascinating subject for me because it deals with biology of a skeleton of a growing child and everything there is to do with it.
right,
So it excited me that I could deal with a patient which was evolving, really speaking, over the years,
right,
and something that changed. And there was a set of diseases which was quite unique compared to the mundane fixing of fractures and trauma care and just replacing. So
true,
it was more biological to me rather than being a medical carpenter like orthopedic surgeons are known.
right,
Here I could also use my brains to come to a good diagnosis, and there was such a variety at different ages, like we are dealing with the children's walking abilities today. So it's a completely different ball game to manage a child, manage the parents, manage the grandparents, and answer their anxieties. So that is what excited me to go into this subspecialty. I was
very,
trained in it in Mumbai. I did my MBBS from GS Medical, and later on from Sion Hospital my MS. And I trained under my mentor Dr. Joy Patankar, who was interested in pediatric orthopedics. So I had a fair exposure during my training itself. And when I moved to Pune and joined Sancheti, I had the opportunity to get into this branch because there was nobody in Pune doing exclusive pediatric orthopedic work.
right,
So you might say that I started the super specialty of pediatric orthopedics in Pune because earlier people used to go to Bombay, and
right,
there was nobody doing exclusive work in children's orthopedics. So I've been at it since 1999, so it's nearing 21 years now. And it's been a fruitful journey, exciting, satisfying, and I love every minute of it.
For sure, I can understand, and I'm so glad that you decided to come live with us and give your valuable time, because you're the perfect person for all the questions that I have today to ask. So let's start with the
Sure.
topic. My first question to you, sir, is why does it appear at times that a child is walking abnormal? This is the most common question that I have been hearing all my life.
Right.
What exactly is that?
So what happens is that walking ability itself is an exciting thing in a child, and people are looking forward to a child taking his first steps.
Right.
And the focus is the poor kid. I don't know whether it's pressure on him, but he's absolutely under pressure because everybody's watching him. The minute he starts standing and walking, or even if he doesn't, it's a matter of concern, right?
True.
रांगला नाही, उभा राहायला नाही, cruising केलं नाही. If the child does not follow his timeline, people are very worried and very anxious.
Very true.
So that becomes a matter of concern to many parents. And being nuclear families today, working parents, they become extremely jittery. So I do get a lot of parents who are extremely worried that the child is not following a schedule or a pattern that they want. People are in a hurry to make their child stand, run, jump, walk, and start playing cricket, I guess.
Yeah.
So that is what happens. So anxiety drives a lot of parents to see me. And
Hmm.
usually the walking age for a child averages about 12 months. At a year to your first birthday, you stand and start cruising or walking with support. And by 18 months, you are walking independently. But the upper limit of normalcy can go up to 2.5 years.
Right.
Okay. So every child's development pattern can be different. So when the child starts walking, he's still learning, his muscles are still toning up, his brain is still coordinating how the placement of joint should be. The anti-gravity muscles are still not strong enough, so they tend to waddle. Their
Right.
muscle tone is not right, so they tend to in toe, they tend to out toe. They have some structural variations. Somebody has a bow leg, somebody has a little knock knee, somebody's got a twisted leg. So there are a lot of normal variations which clear up by about 6 or 7 years of age,
Right.
right?
Right.
And children can walk as late as 2.5 years. So if there is no obvious neurological problem or birth issue wherein we are not suspecting any cerebral palsy or any such disease, it's prudent to wait and be patient. And a lot of treatment essentially is counseling, reassurance, and some physiotherapy, which you guys can help with, so that
Right.
the child gains his strength and ability to walk in a particular fashion. But the
Right.
anxiety levels are quite high, I can assure you that.
Very true. So, to all our viewers, I guess the point to be noted from Sir's answer is कि from 1 year to 2.5 years, from 12 months to 30th months, this is a time period where a child can develop walking and get to his normal walking pattern. And so, there is no reason to panic if there is no neurological deficit or a structural deficit involved. Am I right, sir?
Absolutely, absolutely. And a
So,
lot of structural variations do come in, and we can show you some examples of those as we go
so
by.
you
Not
did
right now.
mention
Hello?
about hello.
Yeah.
Uh,
Yes.
you did mention about normal variation, and that is what my next question is. How
Yes.
to differentiate between normal variation and disease pattern of walking?
Right. Okay. So if you can share my presentation, I have a few slides which I can share with you.
Okay, so I've shared it. You'll just have to
Uh,
go window.
Saurabh, what is happening is that on my laptop, I am not able to see anything, neither our faces nor the presentation. Hello?
Yeah. Uh,
Hello?
yeah. Can you hear
I'm
me?
unable. Yes, I can hear you, but I am unable to see anything on my screen.
All right.
I cannot see our faces, or I cannot see my presentation either. I don't know what has happened.
No, just a blank screen that is visible. But
I
our
can see
face.
a blank screen.
Yes, our faces are visible to others, so I guess we can continue.
Okay.
In presentation, we are
Okay.
not able to share the screen at this moment. Maybe we'll continue, and if the glitch gets corrected, we can show them the video at the end of it or something.
All right. Okay. Are you
Now,
able
sir,
to see?
yes, now I
Can
can.
you see
Yes,
the
I can.
screen?
Yes, I've added it
Okay.
here. Just
Okay.
maximize.
So I'll just show from my end. Can you see this now? What I'm showing you? Hello.
Yes, I can. Yes, I can.
Yeah, so this screen or this slide is actually showing you the normal alignment of the limb, the natural development as it goes by. So all
Right,
of us when we are born with bowed legs. Okay, and the thigh bone, which is the longest bone of our leg, develops around the knee at different speeds. So when
right,
you're a small baby and toddling, what we call as toddler 1 year, the outer side is growing faster, so you have a bow leg.
right,
Okay, and by
right,
about 18 months to 2 years, that bow leg eventually straightens out gradually, and
right.
then the inner side of your thigh grows faster, and then
Hmm.
the leg moves outwards. So you have a knock knee at about 3 to 4 years of age, which
Right,
actually increases to about 5, and by 6 to 7 years, as you can see, it comes back to normal, and
right,
then your adult alignment is actually set by about 9 or 10 years.
right.
So the deviations, a lot of people come saying my child has bow legs or knock knees. It all depends on whether it's a normal developmental variation or it is a disease pattern, and we need to rule that out by taking plain x-rays. Sometimes a
Right,
blood test might be needed, but remember that this is a problem of form and not of function. So what
right.
happens is that the child has a painless limp. Parents come and say child is limping, he can't walk
Hmm.
properly.
Hmm.
Whereas it's not a walking issue, child has no pain, he's running around in the clinic or at home just as quickly or as fast. It's the
Right,
shape of the foot or the leg which makes the parents or grandparents or in today's world the teachers or even your creche people,
right,
whoever is taking care of the child, concerned, and they point out, and then
right.
the anxiety cycle starts.
Very
So
true.
by far and large, a plain X-ray will help rule out. So these are a few X-rays which I had put up for better
Hmm.
understanding. So
Right,
you can see that the outer side is growing a little faster than the inner side, and you can see that there is a little curve to the tibia, which is actually a rotation or a torsion.
right,
So a twisting or in-toeing of the leg can also give rise to a feeling that the child has got a lot of bowing. The
right.
second X-ray but shows that this is underdeveloped, and these are clear signs of rickets. So
Hmm.
rickets or vitamin D and calcium deficiency in diet or not non-exposure to sunlight is one of
Right,
the commonest causes of bone softening in a very young age.
right,
So if you have a soft bone on which you have started walking early and your birth weight was quite hefty and you are weighing about 9 kg at 1 year of age or 10 kg,
hmm,
a soft bone can bend or bow. Now, this
hmm.
is called rickets, and that is simply treated easily by giving vitamin D supplements and calcium, and it reverts within 3 months. And
Right.
then the growth resumes normally, and in the next year or so, the leg should straighten out.
Okay, okay.
Rarely do you have genetic defects or something called as Blount's disease or tibia vara, where you may need. So, this is the correction I was showing. The rickets, when you give medication, it just straightens out on its own. And as you
Right,
can see here, there is a little curvature of the leg in the lower part of the leg, and you can see the kneecaps are facing outwards.
right,
This is a case of torsion. Actually, when the child walks, he walks with toes pointing inwards, and that gives the appearance. See, that is the way to check it. You look at it from the top, and the toes are pointing inwards when the knee
right,
is straight. So that
right,
makes you think that this child is bow-legged, whereas actually it is not bow-legged. It is a torsional problem which straightens out over years, and nothing needs to be done. You can
right.
see this physiological bowing, which over a period of time straightens out in 18 months or so. So you can see it has become straight on its own. And a lot of
True.
children then walk with this in-toe gait.
Hmm,
So
hmm.
in-toeing is also because you may be having excessive internal rotation in your thigh bone, which everybody has,
Hmm.
or a tibial torsion or a foot which is turning inwards. So,
Right.
Saurabh, if you may just continue and finish this point,
Yeah.
can I go ahead? Yeah. So
Yeah. Yeah. Please.
I'm just demonstrating to you a condition which a lot of children have. 20% of normal population will have what we call as genetically hyperelastic joints. You
Right.
can see you can make the fingers go parallel to the forearm. The
Hmm.
thumb touches the inner side of the forearm very easily, and when they stand, their knees go backwards or buckle.
Right. Right.
These children will also exhibit flexible flat feet. So a lot of parents are concerned that they have been told your child has flat foot, that is why he's walking like that. Okay, so
Hmm.
this is just genetic laxity, and they are commonly W sitters like this. So
Right.
they'll sit in the W fashion, and what you need to know is the rotational profile. So the thigh foot angle is measured, right?
Okay.
So that is what you measure, and most of the times, if it is just a problem of laxity, as the child becomes older, stronger, and gains strength, this
Hmm.
improves to a great extent by about 10 to 12 years. And as I said, this is a problem of form, not of function. And second,
Right.
it is a painless condition. So parents need not be worried about it.
Very true. I guess so that explains a lot of questions that people have in their mind, and just a assurance that in case there is no pain and there is no structural anomalies, these things are going to
Absolutely.
get better with age. I guess that's a
Absolutely.
very important
Absolutely.
point that our viewers will surely be glad to know today. Moving to our next question.
Yes.
So, in case like a lot of signs that you just explained right now, which are like going to get better with time, but there must be
Yes.
some signs of early detection of walking abnormalities. Are there any signs like that?
Yes. Yes. So what I can just point out to you, the initial slides, when you
Hmm.
say there is a limp, can you see this, sir?
Yes, I'm just sharing it
Yeah.
again. Yes,
Yeah.
I can see it.
So, yeah, when you say that there is a limp, the first thing is it a painful limp or is it a painless limp? A
Right,
walking abnormality, if it is painless, you shouldn't be worried so much as you should about a painful limp, because painful limbs are usually pathological. Okay,
right,
there will be some problem because of which the child is walking with pain who was
hmm,
previously painless.
right,
Okay, but if he has a walking abnormality which is painless, different set of conditions come into mind. So
right.
if you have a painful limp, this is more for the therapists who might be attending. You should think of injuries, small injuries. Small children slip and fall. They can get what is known as a toddler fracture, which is a
Hmm.
hairline crack on the shin bone, which is not seen on an X-ray. So the X-ray
Right,
might be reported normal. Unless you examine the shin bone and feel that it is tender, you will miss this diagnosis.
right,
Sometimes children can get infection in bone, which makes it painful, or some inflammatory conditions, rarely tumors and metabolic or hematologic conditions. We have seen in the older age group between 4 and 10, if they
hmm,
start limping with pain and the bone is tender, we have seen it turn out to be even leukemia. Okay,
right,
or so it can be as bad as bone cancer, because the blood cancer, because all blood cells are formed in the growing bone. If you know,
right,
the genesis of blood happens in the marrow, and marrow is
hmm,
within the bone. So
right,
children with leukemia can start actually present to us with bone pains. But
hmm,
as I said, a painful versus a painless limp is very important. When it is
right,
painless, commonly, as I said, it is developmental, which means
hmm,
80 to 90% of the time it will go with time and improve with time.
right,
But you should rule out birth defects. Sometimes a child may have a dislocated hip by birth, and he
right,
will limp or walk odd, or walk with a sort of a waddle
hmm,
because he has a dislocated hip.
right,
Sometimes they can have neurological conditions like cerebral palsy. In such conditions, if your child does not walk by about 18 months to 2 years, or
hmm,
he exhibits a lot of delay in his development, does not hold neck, you have had a
hmm,
difficult delivery, the child
hmm,
was born premature, 7th month, 8th month delivery, or he starts walking on his toes, or he walks with dragging feet or a limp. Again, this is a painless limb, but it is not normal or natural. So
Right.
in that condition, neurological conditions need to be ruled out. So
Right.
I'll just show you a video of a waddling child. Yeah. So if we can play this video, can you see this?
Yes, I can.
Yeah. So you can see the gap in the perineum. You can see the widely spaced legs, and the child is walking with a side to side waddle. Both sides are drooping, and the child has an increased lumbar lordosis or a spine curvature which looks a little exaggerated.
Right.
So
True.
this child had bilateral hips which were dislocated, and since this was painless, it was not picked up for 2 to 3 years. So
Right.
we
Right.
must seek consultation even in a painless limb to rule out a few conditions. And you can have, as I said, cerebral palsy, where you can have a walking abnormality like this. You are toe walking, or you're walking like this. This is again crisscross or scissoring gait,
Right.
inability to stand up straight and walk, or you have something called as a crouch gait. Okay,
Mm-hmm.
so these are all limping children with abnormalities who would require treatment.
Right.
Variety of these gaits I'm just trying to highlight so that people, if they see somebody walking like this, then definitely it's a disease process. It's a
Right.
pathology. It's not a normal natural thing. So we must look at these kinds of gaits and advise them accordingly, right?
Right. I guess the
So
video pretty much makes it clear to people that if you see a certain kind of walking pattern, so which are
absolutely,
the walking patterns which you should take, which are alarming and a professional opinion should
absolutely.
be taken. So I guess
Yes. So
showing
two
video.
things. Two things. One is
Hmm.
pain, presence or absence of a pain.
Very
Second,
true.
second is a grossly abnormal method of walking, or a really long delay in ability to walk. He's not walked for 2 years, 3 years. That is definitely abnormal.
Right. Right. Perfect. I guess that clears a lot of things to our viewers, and those showing the video was a very good idea. So people now understand
Yeah.
ki what
Yeah.
kind of walking patterns which are wrong and which should be alarming. All right. So the next
Absolutely.
question is, ki what? So you in the passing you have mentioned what all the causes are there of the abnormal walking patterns, but just to
Yes.
sum it up again, what are the causes behind abnormal walking pattern?
So abnormal walking patterns in the first 2 to 3 years could be physiological, which is more common. Like I said, variations. Second, congenital, which means birth defects in the
Hmm.
hip region, which need to be ruled out. Third, vitamin D deficiency is the commonest in our country, where you have a structural abnormality with a problem in walking.
Right.
Fourth, you could have small injuries which the child may have in the attempt to walk, small falls, or they get toddlers fractures.
Right.
And infections is a very important cause in our country. Any kind of infection, if it gets into bone and joint, will cause a painful limp.
Right.
Okay, and the limb lengths may be short. If you have a birth defect which is unilateral, which means on one side, observe the lengths of the leg also. Sometimes one leg is shorter than the other, so that can cause a limp. If it is
Very true.
painless or if it is delayed, you must seek consultation.
Right.
Otherwise, you could afford to wait. And a
Okay.
few X-rays and blood tests and an examination should be enough. We rarely, only 5% or less may need advanced imaging like MRI or ultrasound.
Right. Okay. So I guess so you have made it very clear that most of the cases by 2.5 years, the walking, if in case there is any variation to a normal walking pattern, is going to get better. In case the
Yes,
walking pattern is abnormal because of ligament laxities or over flexibility of the joint, it will get better around 8 to 10 years.
absolutely,
Right.
absolutely.
What I want to ask next is, ki, does all the problems get better with age, or in what kind of problems medical intervention might be required?
Right. So, like I said, I'll put up again a slide for you. If you can just share the screen here.
Yes, I can.
Yeah.
Yes,
Okay.
it's
So this slide I have put up to just show you the exaggeration of deformity.
right.
So we have a rule of thumb where we measure the distance between the thigh bones at the knee level for bow
Right.
legs, and between the ankles for knock knees. So on your
Right.
left, you can see a bow-legged child. On the right, you see a knock-kneed child.
True.
So if the distance is more than 10 centimeters at 4 years, okay,
Mm.
it's a rule of thumb that 4 inches at 4 years, 4 inches is 10 centimeters.
Right.
So a deformity of this magnitude physiologically cannot correct itself.
Right.
Okay, simply the axis is so bad that it is not possible that the body or nature can correct it by itself in spite of growth. So here we will need to intervene, and we may need to do a combination of a growth modulation. Today we have a tool which is very powerful. What it is called? It's called an 8 plate. You can see the small clip, like if you are teething and your teeth come crooked, the dentist
Right.
just put you on braces so that they come in a particular way. Okay, the
Right.
growth of the teeth is monitored and modulated. Similarly, we can put these small little plates and screws on the bone, you can see, and stop growth on one side temporarily to
Right.
allow the other side to catch up and correct the deformity.
Okay. Okay.
As you can see in this particular case, a growth modulation has been done, but there was a lot of torsion in the shin bone, and you can see here a small density. I had to
Right.
do a small bone cut there, and we gave a plaster to straighten it out. So
Right.
this is how we straightened it out. So another example to show you a knock-kneed child who had an abnormal development of his thigh bone, excessive growth on one side, and we put in small clips, and over a period of time, the leg straightened out and became normal. Okay, so we can do the same thing in growing child. Now, if you come to me with this deformity when you're 10 years old or 11, when your growth is now not remaining, then growth modulation may not work. Then we have
Right.
to do osteotomies, which means cut the bone and then try to make it straight. So
Right.
those are bigger operations. So it is better always to pick these deformities early and treat them with growth modulation. And as I
Right.
told you, if rickets is the cause, simple medication to correct the disease
Hmm.
followed by natural growth can also correct the deformity. But if the deformity is so bad, then we need to do this.
Right. Understood.
Yeah, and if there are infections, then we need to treat them by antibiotics. Sometimes if there is a pus pocket within bone, we'll have to drain it, drill it. And if there is a dislocated hip by birth, obviously all birth defects have to be operated upon. There is
Right.
no medical treatment for birth defects.
True. Okay. So I guess you have so most of the surgical or medical management you have given us a fair idea about that. So
Yes.
being a physiotherapist, I would like to ask ki, what is the role of physiotherapy and what kind of exercise approach or treatment approach is required in such kids where maybe the deformity is not as bad, where the surgical or
Yes.
invasive
Yes.
intervention is
Absolutely.
required.
So while we are waiting for natural or spontaneous correction, even in hyperlax children or with flexible flat feet, we need to tone up their muscles, because mainly toning up anti-gravity muscles is going to improve the form as well as function.
Very
So
true.
if we can do that by pediatric therapy or play therapy or aqua therapy, people get into pools. I always advise them that you need to, one, go out in sunlight and play for 45 minutes minimum so that you get adequate vitamin D.
True.
And you must probably, if you have hyperlaxity, a good sport is gymnastics and ballet dancing. You have to get on your toes. When you
Right.
get on your toes and toe walk, your anti-gravity muscles are toned up. So physiotherapy plays a very, very important role in toning up muscles so that structure and function both improve. As well as in cerebral palsy, it is the mainstay of treatment. In fact, orthopedic intervention will happen only infrequently when stiffness goes beyond a certain limit, and we
Very true.
might do Botox or surgery, but rest of it is physiotherapy. So they have to work on physio when they are growing. So physio need not mean all the time you need to go to a physiotherapy, but you can learn some things and do them at home, and make sure your kid has plenty of sunshine, good calcium rich diet, apples, milk products. And if you're a non-vegetarian eater, then fish, chicken is good. Red meat, instead of red meat, you give white meat.
Right.
And all egg products and milk products are good to build up bone and muscle mass.
Right. Okay. Okay. I guess thank you so much for answering that. So next, apart from the structural and systemic problems, does
Yes.
walking problems happen because of any functional deficit, or a child starts walking in a certain way, starts sitting in a certain way? Are there any functional deficit because of which walking abnormality is happening? And if that is so, what are the precautions that parents can take?
By functional deficits, what do you mean, Saurabh? I did not get your
Uh,
question.
so
Hmm?
sometimes there is a common misconception or belief in people that if you, like you mentioned about a W sitting,
W
like
sitting, yes,
if
yes.
the child sits
So
like that,
let
yeah,
yes. So let me just explain that. See, basically, when we are born, there is a shape to our thigh bone in the hip socket,
right,
and everybody has a different angle to the hip joint when they are born.
hmm,
And some children exhibit excessive internal rotation. They don't have external rotation in the hip. So sitting cross-legged, which is the common way that we sit on the floor, mandi ghalun.
right, right,
Okay, they are not able to do that, and they easily go into that W position or Vajrasan position.
right,
Now, that is because their thigh bone is made such. They are not doing
right,
it willfully. It's not an habit.
right,
Okay, but we have to create a reverse habit in them of sitting cross-legged to counter the nature's effects, so that as they grow older, then the leg slowly straightens out.
right,
So they are not doing purposefully, but some children have excessive internal rotation. They will in toe when they walk, their toes turn inwards, and they
right,
will sit W position. So
right,
physiotherapy to make them sit in that cross leg position and out toe will encourage derotation as they grow older.
right, right.
So
Okay.
that is really the thing. It's the
And
structural thing that drives function.
understood, understood. And like you said, kids, there are normal variations to a walking pattern, and with about two
Yes,
and a half years of age, they will get better. So, are there any precautions that parents can take so that a complete recovery is achieved, or complete normalcy is achieved more than recovery? I would say.
absolutely. Yeah. So the thing is, one is that they should not panic or get impatient because growth is a slow process. You can't hasten up growth.
Yeah, that's the
Okay.
most important
So
point.
that is very important because they get anxious and then they subject the poor child to a lot of unnecessary braces, shoe wear, inserts, which the children absolutely hate. And
True.
they'll go out and enthusiastically buy some fancy footwear inserts and the child will never wear them. And then they feel that we bought the best stuff and why is the child not straightening out? It's
True.
because it needs time. And the footwear really did not help him because it hurted him. So for
Right.
physiological conditions, it's more important that they concentrate on physiotherapy rather than shoe inserts.
Right.
And what happens is that a lot of physicians also, it's a loose comment made by somebody, or it's a convenient diagnosis that okay, just go and wear some shoes. So it's more to treat parent psychology than actual disease, right? So
Right.
I find there have been enough studies in the world which have shown that fancy shoe inserts don't really change the shape of the foot. It is
Right.
growth which changes it. So you have to wait for growth. That's number one.
Right.
So don't get too anxious, number one. Second,
Right.
when you have intoing, you inculcate good sitting and walking practices. So
Right.
whatever the therapist has told you, make sure that the child spends enough time doing that. Because
Right.
behind your back, he is going to go into the same earlier posture because that is more convenient for him.
Right.
Okay, and that is natural for him. So
Very
till
true.
he outgrows it, you have to just be patient and make sure that he follows the physiotherapy instructions, and once in a year you could come for a checkup. So what we always say is come back next year, because before that there is going to be no change in the shape and structure.
Right.
Okay, parents sometimes when we tell them physio, they'll come back in 3 weeks and say abhi bhi aise hi chalta hai.
Hmm.
So it's not like a medicine that 3 हफ्ते में काम
True.
करने वाला है. So the thing is that be patient for physiological conditions.
Right.
If it's pathological, painful, as I mentioned, the red flags.
Right.
All right. Birth defects, painful limbs, high fever, asymmetry, one leg long, one leg short. If something is going wrong that way, or delayed walking or neurological issues will be tackled more aggressively.
Right. I guess you have very simply explained and put it that until unless there is something extreme abnormality that you see or painful walking that you see, be patient, and the nature is going to take its course and the child would be better. And
Absolutely.
you rightly mentioned about footwear and all the fancy bracing and everything is done. So in case until unless your a doctor prescribes that to you, I don't think so. That is
Yes.
something you could go for on your own.
Absolutely, absolutely, absolutely. Because there
Right.
is so much stuff there, and you feel, why is it not working?
True, very true.
Yeah,
So
and don't Google everything because Google is a killer.
yeah, very true. I guess with Google and all the milestones in a tubular format being available everywhere, delayed
Yes,
milestones is
yes,
another thing that a child is continuously validated against a chart,
absolutely. Yes.
and that
So
could be
the second problem, Saurav, I find is that comparison. Okay, the
true, very
child is always compared to the next door neighbor's child or the school's. He's walking straight. Why is he not walking straight? My older one did this. The
right,
younger one is taking too much time. So it's okay as long as it's not pathological. Every child is different. You cannot have carbon copies of each other.
very true, very true. So we are almost at the end of the conversation. I would like to request the viewers, in case if you have any questions for Dr. Patwardhan, please put them in comments, and all the relevant questions Dr. Patwardhan will answer. So my last question, you have mentioned in passing about dietary supplements. So
Yes.
are there any dietary supplements to help with walking problems in children?
Not
And
really. So dietary supplements are essentially for improving your bone structure, muscle mass, and strength, but
right,
they don't have a direct one-is-to-one correlation with change in form and function.
right, right,
All these are general. So when people or your pediatrician gives you vitamin D, calcium supplements, it's for general growth. It's not you have a bow leg, you give 3 months calcium, and you say abhi bhi kaise nahi seedha hua, because it's going
right.
to take 2 years.
True, true. And
Yeah,
because
it's
there
not
is
a medicine, it's a
uh,
supplement.
and that's why I wanted to put this question, because there is a misconception out there ki, because a nutrient is missing and that's the reason why there are problems. So of course having a nutritious diet is important, but that's
Yes,
not a direct correlation between
yes.
them.
So once the nutritional problem, if it exists, is documented and treated, you still have to wait for nature to make it straight for you.
True,
So which
true,
takes its own time.
very true.
And monitoring is important. So you should come for a checkup and we do the measurements. X-rays also are not needed after 1 or 2 times. And then,
Right,
as I said, the measurement intermalleolar, intercondylar, so that we know whether the angles are improving or not. And the parents
right,
will tell you, "Aata barat sarad distoy," etc.
very true. So we are getting a question. So one question that
Yeah,
we have is, so please tell about CP child walking problem.
yeah. So cerebral palsy, unfortunately, is a disease which causes a permanent gait problem, which means walking ability problem. That is because of a difficult delivery, complications in labor, multiple pregnancies, infections to the brain in childhood less than 1 year, or you have a 7 month delivery or something like that. Now, what happens actually is that a part of the motor cortex is that part of the brain in your upper part in the midline, which controls the uh, stiffness in the muscles of the hand and the feet. Okay,
Right,
so if there is a hypoxia or bleeding there, it creates an internal scar in the brain, and that scar always gives you abnormal firing signals to the limbs. So a lot of times I will see a child who has a walking disability but is intelligent, can hear well, and is very, very smart. But when I tell the parents that his problem is in the brain, they refuse to believe. Okay, there is
right,
acceptance issue. What you have to understand that brain has various parts which control various functions. Now, this CP is a disease which damages only the motor cortex, which means that the walking patterns can be altered, but rest of the brain can be completely normal.
right,
Right? So these children can present with tiptoe walking, delayed walking, inability to stand and walk, and according to their ability and damage in the brain, there are 5 grades. Okay, which is called as a GMFCS grading. It varies and it changes with age, but by far and large, at 6 years, if the brain is mature, the child is one If he is mild CP, he is walking independently, can climb stairs, and is near normal, but for a small limp, which may be noticeable.
Right.
A level 2 child is able to walk independently, climb stairs, but will require assistance. He needs to hold on to the railing and may require some corrective footwear.
Right.
A level 3 child is somebody who needs a walker, braces, and he can walk up to 50 meters with help in familiar surroundings, which means in the house, in the school, where he knows the layout and can has been taught to walk. But long distances, 500 meters and above, he needs a wheelchair.
Right.
And level 4 and level 5 are non-walkers. Essentially, they don't walk. They can be just made to stand. And level 5s are non-walkers. They're bedridden. So
Right.
every child, depending on how much is the severity of damage to the brain, can have a varied presentation. All of them are CP, but they can have different presentations. So we can help level 1 to 3 to walk better by interventions, by physiotherapy to loosen up the muscles, by botulinum toxin injections to loosen up the muscles, and surgery between 8 years and 12 years. We delay surgery as far as possible so that we don't have to repeat it or weaken the muscles. But therapy has to go on.
Right.
But level 4s and level 5s are non-walkers, whatever you do. So those actually need to be made to taught how to sit properly, and the parents' burden of caring for them has to be reduced by improving their hip abduction so that they don't dislocate their hips and become painful, and
Right.
prevent the spine from going crooked. So we don't
Right.
expect them to walk, but at least in a wheelchair they should be seated properly and should be pain free. So that is about CP. So depending on how the child is, what level he, and what are his deformities, then we can offer a rational plan of management. But
Right.
CP, they have to realize that CP is a brain problem. It is not curable. But if it is managed well, you can make the child independent. So
Right.
don't talk of normalcy here. Talk of making them independent.
True. I hope Shobha that has answered your question. She has one more question for you, sir. So my child is 7 year old and she is stand and walk with support. I guess she's able to stand and walk
Probably
with
CP.
support. Yeah.
Yeah, at 7, she is walking with support is a delay, definitely. So she will need to be put into one of the categories after examination.
Sure. So basically,
Hello.
Shobha, yeah, you can get in touch with Dr. Patwardhan. He
Yeah.
has his OD at Sancheti Hospital. You can take his appointment and come and see him for sure. Thank you for answering that. Yes, that's all the questions we have. And thank you so much, Dr. Patwardhan, for taking out
Thank
a time
you.
on Sunday evening and coming in, sharing your thoughts in a very simpler way, which was easy to understand for all our viewers. You have given some insightful information about be patient. Most of the problems that you see in a kid's walking are going to get better by 2.5 years. You have given a thumb rule for which, like, you have shown some abnormal gaits. If you see such kind of gait patterns, that is where you require medical intervention. And you've seen how a correction surgeries and other treatment options are available. So worst case scenario, in case your kid is suffering from something like that, it is completely possible to get him back to normalcy. So I guess we have answered all these questions which were on my mind and a lot of our viewers and a lot of people's mind about their kids and their walking. Thank you so much once
Great.
again on the
Thank
phone.
you. Thank you, sir. Thank you. It's been a pleasure, and I hope people make use of the information. Thank you.
They surely will. And to all our viewers, keep following Helios and Sancheti Hospital. We are going to keep coming with newer episodes of a surgeon's perspective. Next Sunday, we have another surgeon with a very insightful information. We will keep you updated on that. Thank you so much for watching.